lot of times people tell me, I don't need to go to my doctor, I feel fine. But there are diseases that can be very serious that cannot be detected by a patient, but only detected by blood tests or by a blood pressure measurement. So visiting your doctor regularly is very important to pick up those diseases like hypertension. Many of the chronic conditions are monitored with blood testing and other body fluid testing, and we are in charge of the laboratories. The most common laboratory test that patients will have for screening, number one would be a complete blood count. Most people are familiar with that. That is done partly on an automated machine and partly also under a direct microscopy. And a complete blood count gives us information about whether or not a patient is anemic, has an infection, or in some cases, vitamin deficiencies, or even malignancies like leukemia. Sometimes in pathology, we have to be detectives, and in this case, these long, thin, blue structures are bacteria, and they shouldn't be there. Okay, and what about this patient?
This patient is an ER patient.
Other important tests include chemistry tests, such as serum glucose, which would be an indication of diabetes. For women, pap smears and HPV testing to detect early dysplasia. That could be an indication of early cervical cancer, which is definitely a curable disease. For men, PSA testing is very important for prostate health. And for both men and women, cholesterol testing for heart disease prevention and thyroid screening. And all of these tests are designed to keep you healthy.
Yeah, the doctor knows about it.
Okay, great. Okay, thanks, Tina.
Okay, thank
All
you,
right.
Dr.